Hello, everyone. Welcome to DRM Focus Days 2021. This session is Preparedness Response and Government Continuity, building systemic capacity for the most time-critical elements of disaster risk management. My name is Adam McAllister. I will be moderating this community session on behalf of the World Bank today. May I ask that for those of you that are participating in this session, if you could please keep your mics muted and ensure that your video is off as we manage through the session. During this hour, we will explore emergency preparedness and response, or EP&R, capacity developments throughout the Caribbean. It's my great pleasure to introduce our panel for the day. We will start with Ms. Andrea Grosvenor. Andrea, there you are. Andrea is the Deputy Executive Director of CDEMA, the Caribbean Disaster Emergency Management Agency, a humanitarian with a passion for helping people manage disaster risks, to which she has devoted herself for the last 25 years. Ms. Grosvenor has been the focal point for coordinating the development and application of the comprehensive disaster management strategy within the Caribbean for over a decade, which includes the reporting on the regional achievement of results and contributes to the Sendai Disaster Risk Reduction Framework. At CDEMA, she leads the Technical Program Management Division with responsibility for the strategic and technical leadership of the agency's integrated disaster risk management program, which includes preparedness, response, recovery, disaster risk reduction, research, training, and others. Next, Mr. Regis Chapman. Regis, where are you? There you are. Mr. Regis Chapman is the representative and country director for the United Nations World Food Program Caribbean Multi-Country Office, and he coordinates the WFP's emergency preparedness and response engagements throughout the Caribbean. He has over 20 years of international development and humanitarian experience, including the past 15 years working with the WFP and previous senior roles with the Red Cross movement internationally as well. Mr. Cristobal Mena, where are you, sir? There you are. Good morning. Mr. Cristobal Mena is a senior DRM consultant for the World Bank and former deputy director of the Chilean National Emergency Office, where he led key policy changes at the national DRM law and within the Disaster Risk Reduction National Policy 2020 through 2030. He has worked for the World Bank on government continuity and building search and rescue capacities in Central Asia and Europe, as well as in the private sector as an emergency manager in the energy industry. He also lectures regularly on emergency planning, risk management, and disaster risk management policy. And we have Ms. Doreen Gustave. Doreen, is your camera up? There you are. Good morning. Doreen Gustave is an experienced leader in the Caribbean disaster risk management community and is the director of St. Lucia's National Emergency Management Organization. She has extensive knowledge of St. Lucia's government, having supported various government initiatives in management and community development roles. Her leadership and foresight have led to significant practical improvements to St. Lucia's emergency preparedness and response system. And Mr. Joaquin Toro, sir. There you are, smiling as always, great to see you. Joaquin Toro is the regional coordinator for disaster risk management in Latin America and the Caribbean at the World Bank. He joined the bank in 2003 in the Latin American and Caribbean region and has helped set up that region and the Europe and Central Asia region's disaster risk management team. He is one of the founders of the Understanding Risk community and those associated forums. He has more than 20 years of disaster risk management experience built upon a foundation of operational emergency response engagements. Welcome to you all. Thank you for joining us this morning and for lending your insight and your time to this session. I'd like to get started with a number of 5-minute roundtable engagements with each of the panelists. To give us a sense of an overview of what they see as some of the advancements over the course of the last decade within the Caribbean as it relates to preparedness and response capacity. Perhaps I could ask Andrea if you might be willing to share your insights with us to begin.
Thank you so much, Chair, and thank you so much for introducing me. It's certainly a pleasure to be a part of this ST panel to share the floor with them. From us at Sedima, we want to share some key messages that we think is important to this dialogue as we look at preparedness, response, and government continuity. First of all, as small island developing states, such as ours in the Caribbean, we experience the world's highest frequency of natural hazards. Among them are hurricanes and other violent storms that lead to severe flooding and in some cases, the loss of lives, homes, and infrastructure. We now live in the reality of multiple simultaneous disasters. We have a global pandemic, we've had a volcanic eruption, and an above normal hurricane season, which has already impacted many of our participating states, and an earthquake devastating a portion of one of our countries. The need for us to have a resilient Caribbean is therefore recognized by the Caribbean community as a strategic imperative, given the vulnerabilities and impacts suffered by countries in the region over the decades. At Sedima, we also recognize the nature of our risk is systemic, and we do need to move away from the traditional idea that events are isolated, and hence there's a need for systemic risk governance to appropriately match the nature of systemic risks. In the context of CDM, which looks at the all hazards, all phases, all people's approach to resilience in an integrated manner, including intersectoral approaches, we recognize that we have to have a risk governance landscape that really embraces the whole matter of the CDM approach. But we also recognize that the landscape of risk is evolving, and so therefore our approaches need to evolve in that manner. And so even as we are seeking to strengthen the articulation and roll out of the CDM with the resilience framework, which was agreed at the heads of government of the Caribbean community in 2018, and seeking therefore to strengthen those 5 pillars of strengthen the interaction and the articulation, even in the implementation around those 5 pillars. And those 5 pillars are of the Caribbean pathway to resilience is social protection for the marginal and the most vulnerable, safeguarding infrastructure, enhancing economic opportunity, environmental protection, operational readiness, and recovery. And we know that this is very much in aligned to the World Bank's 360 resilience approach, as well as the approaches of many of our UN partners and those who are sharing sharing with us today. As we consider the preparedness, response, and government continuity and the need for building systemic capacity for the most and critical elements of disaster risk management, this may be more appropriately aligned to Pillar 5, operational readiness and recovery. Nevertheless, this should not be divorced from all the other pillars, lest we be in danger of advancing a siloed approach. And in considering these matters, we want to note that there's some key foundational and reinforcing elements that will be important on the delivery of this agenda. First of all, the enabling environment guided by policy, legislation, and regulations, having appropriate capacity development, research and data management, information and communication technologies, looking at how we treat with disaster risk financing, governance, having real participation and involvement, and the political economy. As we seek to strengthen the capacity of our participating states, a key instrument that we utilize in terms of looking at their own capacity for this is the Comprehensive Disaster Management Audit Tool. The CDM tool was developed in 2011 and has been enhanced. And it was really developed by CDIMA and our stakeholders to assess the capacity, the strength, and the resources of our participating states around the 4 phases of disaster management: mitigation, preparedness, response, and recovery against those DRM standards. So it's already a standards document. And the recovery section of that CDM audit tool has now been enhanced through collaboration with the World Bank. It has basically three scores. The standard has not been met is 1, the standard has been partially met is 2, and the standard has been fully met is 3. And the tool covers many of the areas that I talked about before in terms of the enabling environment. It also covers the communications, the equipment, facilities, resources, personnel, warehousing, a number of these. And this is used, the results is used to inform our plans, our strategies with the states, and advancing the agenda at the national and regional level. I just want to close off my initial statements to say that as we've assessed the capacities of our participating states, for preparedness and response, generally the standards are partially met, or sometimes in some cases, in some aspects of the standards, they are fully met. What we recognize is that the whole matter of recovery is a major issue. And if we are going to deal with states being able to address their issues, the matter of how they treat even the recovery as a part of the preparedness is very important. So areas such as continuity of operations for the private sector, government continuity, debris management, and those type of things, those issues are weaker. And we've seen this come over in the recent events that we had in 2017 and 2019 for Hurricanes Irma, Maria, and Dorian. So I look forward to the conversations with my colleagues, and I hope we have an opportunity then to discuss further as we go further into this conversation. Thank you.
Thank you, Andrew. That's great and helpful insight. We heard about a lot of the great work regionally that SEDIMA is doing, some of the agreement in terms of the comprehensive disaster management, the 5 pillars, and looking at where preparedness and response fits within that system. But I think importantly, what you noted was that it doesn't exist in isolation, that it really is part of a larger framework, and it's important that we consider it in that light. And absolutely, we will touch on some of those elements later in the discussion in terms of what other things does a government need to do to ensure that it can operationalize the preparedness and response system, prepare what needs to be prepared for in advance, and respond to those events that require it, while also looking past that point into the transition to recovery. So thank you very much for that. Mr. Regis Chapman, if I could ask you to join us and give us your thoughts from the World Food Programme and what your thoughts are in terms of recent developments within the Caribbean related to emergency preparedness and response.
Thank you, Adam, and thanks to the World Bank for asking us to participate in this panel. Good to see several of the panelists again as well. I guess maybe to start is to really highlight that responding to these high or multiple impact sudden onset disasters can really be quite challenging in the Caribbean. What we're seeing now is this compound crisis with COVID-19 coupled with the climate crisis, but also quite importantly, the issue of lack of fiscal space for governments in the region, and this challenge that they have with the global development financing rules, which don't account for some of the vulnerabilities that Caribbean SIDS face. And this is really the reality of SIDS is just simply different from other countries. These events, when they occur, they have a much more catastrophic event. Andrea mentioned 2017, and we all know the case of Dominica with Hurricane Maria, and essentially the country was destroyed. I think it was something around 80% of the houses had lost or damaged roofs. It was estimated that 220% of GDP was lost on one single day. Sitting in Europe or North America, one could never imagine such a scenario. I mean, you see such events in other places, but again, in the context of a SID, it's just significantly magnified. And so as we look at the Caribbean, DRM systems are well established in the Caribbean's really been a model, I think, for how national, regional, and international can better work together. And SEDIMA, Andrea mentioned the CDM, and there's also the regional response mechanisms. SEDIMA has really been at the heart of bringing that together. So the World Food Program, we opened our multi-country office in the Caribbean based in Barbados just about 3 years ago. And that was really to work alongside SEDIMA, national governments, and other partners to strengthen capacities in areas of WFP expertise. And that's really been on looking at end-to-end supply chain management. So how do you go from assessing a need and determining the source for relief items, if it's relief items or other types of programs, but down to that last mile delivery, where I think there's a lot of challenges in this context. We're also, looking at areas of social protection, the assessment and analysis work that the World Food Program does, disaster risk financing, and now more recently, food systems, as COVID-19 has really exposed some of the fragility of food systems in the region. And there are certainly important links to disaster management and emergency preparedness and response in that regard. The decision to increase the presence of the World Food Program here was based on the experiences of responding really to Hurricanes Irma and Maria in 2017. And there was a bit of a reflection among a number of our partners and also internally that in light of the climate crisis, in light of these increasingly complex situations and the vulnerabilities that we see in the Caribbean, that simply the capacities and capabilities of WFP were lacking from the English-speaking Caribbean. So while our emphasis has really been on ex-ante support by strengthening systems and expanding the necessary response assets, enhancing skills and capabilities of response personnel, we've also been regularly called into action when emergencies strike. And those are various types of emergencies. So it's obviously the 2017 hurricane season. It was Hurricane Dorian in 2019, but also the COVID crisis. And again, the socioeconomic impacts that situation had, and then most recently the volcanic eruption of La Soufriere in St. Vincent and the Grenadines. And so whether it's preparedness investments or response actions, really where we've tried to place focus is on the most impacted by these different types of shocks. So really putting a people-centered approach to some of these systems. And I'd say despite the strength of the disaster risk management in the region, there really remain some significant gaps as this situation evolves. And I think we'll talk about that a little bit throughout the panel, but really the vulnerabilities of the region are changing. And I think there's a need for us to relook at some of these emergency preparedness and response mechanisms to make sure that they're adapted to the new normal, whether that's dealing with pandemics or just simply the increasing severity of large-scale climatic shocks as we've seen over recent years. So thank you.
Thank you, Regis. That's great insight that you're providing in terms of the World Food Program's approach. And I heard you mention this idea that consequences can be magnified and are certainly much more significant across the Caribbean, and this idea that it can sometimes be beyond the imagination for those, or for at least some of those, that may be in areas of the world that aren't affected as often by significant natural hazard events, and may also have more financial bandwidth and inherent resilience to deal with those consequences when they do arise. And I think that is an important consideration. And that leads me to the second point that you had raised that I thought was a very important one, the idea of maintaining a focus on individuals. That economic is important, but ultimately the reason that we do what we do is to support people, and that public safety comes first. The economic risk transfer is, and the financial risk transfer, certainly important, but the public safety does come first. And that's one of the reasons why the time sensitivity is so critical with preparedness and response systems. I also thought your note around organizational evolution, evolving, and how that matches and needs to match the changing vulnerabilities, the changing hazard profile within the Caribbean. That's also quite a good insight. If I could please ask Doreen Gustav, the director of the St. Lucia National Emergency Management Organization. Doreen, are you able to unmute? Excellent. If I could ask you for your remarks now.
Yes, good morning, everyone. It is my pleasure to be part of this esteemed panel. Thanks for having me. Due to our size and location, St. Lucia and by extension, our region, are exposed to a number of hazards. Those hazards stem from natural and human-induced, which include hydromet events, which brings about flooding and landslides. We have earthquakes, droughts, and even technological incidents. It is therefore critical that we continue to update and strengthen our response mechanism in a holistic manner. Inclusion is at the center of this approach as we forge a resilient pathway for all persons, including persons living with disability, and to ensure that it is also gender sensitive. The aim is to minimize the loss of lives and livelihoods and to ultimately reduce suffering. It is with all of these considerations that we felt it was urgent that we embark on these updating and strengthening of our preparedness and response mechanism. Some of the activities that have been conducted by NEMO and other government agencies to date is to prepare St. Lucia to become a nation highly resilient to hazard impacts include the following: development of a disaster risk financing policy. This policy creates a disaster fund, which is to be used to finance ex ante and post-disaster preparedness activities. The policy also ensures that St. Lucia is insured through CRIF for tropical cyclones, earthquakes, and excess rainfalls. With the assistance of local and international partners, we have been able to complete a number of interventions. We started with the review of our legislation, plans, and SOPs, which were quite outdated. Several consultations were held with various stakeholders to ensure inclusion of climate change and other considerations. We had an internal review of the needs of the organization, and with the assistance of the World Bank, we were able to achieve the following: the strengthening of our emergency telecommunication system, and that is to build redundancies in our communication, the equipping of our NEOC, and the upgrading of our network system to ensure that information is disseminated in a timely manner, the procurement of 2 search and rescue drones, one for the fire service and the other for NEMO, and we have done training for persons, for pilots and other operators, the implementation of a disaster information management system to ensure that NEMO has a central repository for its information, the review of the operations of NEMO, that is to identify gaps and to make recommendations for strengthening, training in MCM, in CERT and DANA, and those trainings are ongoing as we speak. With the assistance of USAID, DHA, we have reviewed our shelter protocols, taking into consideration COVID-19, and that was approved by Cabinet in 2020. USAID, DHA also financed training in shelter and shelter management, and also assisted us with the review of our legislations and plans. So we have done a number of training for our community personnel, for the district disaster committees and our national committees also. The completion and approval of our country work program has allowed St. Lucia to develop an all-hazard, whole of society approach to disaster preparedness and climate change. The CDM methodology in its planning for disaster risk management was integrated. The CDM approach, as developed by CDMA, ensures that all sectors of society, including vulnerable persons, are involved in disaster preparedness and response. We have embarked on a robust continuity of business in both the public and private sectors. For the public sector, USAID BHA financed a consultation with all permanent secretaries, and they are the policy influencers and heads of departments in government, in order to help them get a better understanding of the disaster management system at the local level and also at the regional level. They also got a better understanding of the need for functioning liaison officers in every ministry and departments. And following that meeting, we had a 2-day training with the liaison officers in preparing emergency plans, and also to help them understand their roles and responsibility at ensuring that the plans are tested and working for their entity. For the business continuity, in 2019, St. Lucia signed on to the RISE network under the UNDRR, which works with the private sector at assisting with continuity of business post a disaster event. The Chamber of Commerce is a pivotal partner to this engagement. The Chamber and NIMO have held several stakeholders consultations in order to ensure the continuity of business for their various members. Some have completed the business continuity plan, while others are being engaged at this time. The National Emergency Management Plan, the NEMP, provides the foundation for emergency management in St. Lucia, detailing how the country responds to all types of disaster incidents. Responding to disaster and emergencies requires the cooperation of a number of agencies, locally, regionally, and internationally. At a level 3 activation, the NEOC will require operation support, rapid needs post-disaster assessment, and sectoral damage assessment support, regionally and international humanitarian organizations such as CIDIMA, UNDAC, the Red Cross Movement, among others. CIDIMA has a trained team of experts and disaster practitioners as part of the regional response mechanism, and you heard that from Andrea earlier. CIDIMA is in the forefront of ensuring that bilateral agreements can be utilized to strengthen the capacity of local response agencies through resource mobilization, capacity building and training, and technical assistance. Within the RRM, CIDIMA has a number of trained expert teams, namely the RNAT, the COAST, CIDAC, and CDRU. These teams consist of technical experts to provide not only operational assistance, but also technical, rapid, and sectoral post-disaster assessment.
Thank you, Doreen. Oh, sorry. Did you have? I didn't mean to keep you there. Did you
we could actually stop there. Thank you.
Okay, thank you very much. Some quite insightful comments there as well that I wanted to reflect on. And you did note this, the tie into some of the comments that Andrea had made earlier in terms of the systemic capacity and looking broadly at how preparedness and response really does need to fit within a larger framework of disaster risk management, and perhaps even more broadly in terms of whole of society resilience. I think that's quite a valued point. And another point you mentioned right off the top was gender sensitivity in terms of building resilience, and in particular building capacity within preparedness and response. And this was something that builds on a note that Regis had made earlier, in that we need to make sure that we are matching and evolving to the vulnerabilities that we see, but also that we are evolving to match our understanding of vulnerabilities that we didn't have before, but which have existed for quite some time, with gender sensitivity being quite important amongst those. If I could please give the floor over to Cristobal Mena. Are you available?
Always available.
There you are. Wonderful. So please, can we have your thoughts?
Yes, definitely. I think that probably the first reflection that we should be doing, of course, is that we know that disasters affect our communities. That's something that it's obvious. But probably it's not that obvious that sometimes we forget when we are on the government side that we are also part of the communities, that disasters also impact the government infrastructure and also the emergency response capacities. Because, well, as I said, the government, the local infrastructure, it's part of the community. And that's something that Unfortunately, more often than not, we assume that the response capacities and the government functions will be available after a disaster. But unfortunately, and this is what we've seen in experience in the Caribbean and in other parts of the world, is that unfortunately, governments have to tackle these pressing needs after a disaster with scarce resources and often with limited information. So in that scenario, it's probably a good practice to challenge some assumptions that we have on our planning on how we will respond. And that means, for example, what we saw in a Caribbean country some years ago after Hurricane Irma, this building that you see houses the fire department, the ambulance service, and also the crisis management center of this country. And after Hurricane Irma, due to the severe winds and the strong winds, for example, the bay doors were blown away. Also the door of the entrance to the crisis management room was also blown away, and part of the crisis room was damaged due to the strong winds. So we see with these examples that not necessarily we are ensuring that the capacities that we have to respond to a disaster will be in place, will be running in a timely manner, because again, sometimes we make assumptions, and probably what I want to share here is to challenge some of those things. Particularly, we can pose the question how can the government deliver a proper emergency response and provide essential services if the government does not plan and invest in the resilience of their institutions? Therefore, we must be aware that our operational assumptions might be unreal or unfeasible. And that's something that we have to be aware of, that sometimes what's written on a plan, it might sound perfectly, but what we've seen in the experience is that sometimes those assumptions are not feasible. And that's important that we have that in mind so we can challenge that and plan accordingly. But even though it might sound a little pessimistic, the approach, the truth is that we know that disasters are not natural, which means that we can take action to reduce risk and foster resilience. And this is an example of what we did with the Resilient Cities team in Thessaloniki in Greece, and with our team of the World Bank, in which we performed a government continuity plan for the local government. So what we did, it's extensive research first on what services the municipality of Thessaloniki provided, and what were the functions that actually sustained those services or enabled them to be performed. Then what we did, we identified which of all those services and processes were essential. I remember that there were around 400 functions, 200 services, and we came up to 20 essential ones that were necessary to be performed in any case. And then what we did is that we linked those plans with 4 main elements. First, human resources. We need people to actually make things happen, to make the services work. We also need a place, an infrastructure that's available to perform those tasks. We also need IT, we need technology, we need information, we need communication systems to perform that. And finally, we need leadership. We need a leadership that not only is available to respond, but also that assumes that preparedness is essential, continues essential to perform those response actions in the future. And this is what we've been seeing, that it's important that we invest in government continuity, that emergency preparedness, it's not only how we plan to go outside to respond, but also a more inwards approach on how to do this. And for that, I just want to share, to close, some reflections on why we have to invest in this. So Do disasters affect government continuity? Yes. Can we take action? Definitely. And one of the benefits that we can see is first that we have a better response when we have the capacity to actually put our services to work. That it's a better response, which also gives us consistency in how we respond to the disasters. Third, we reduce risk when we identify the gaps. We actually know where are the problems in our planning, and we can reduce those risks and also increase capacities to respond. That can lead to, for instance, reductions on the costs of insurance. And finally, its reputation. We must lead by example. That's an essential example that we have to be really aware of, that if we want to be an emergency management agency, if we want to be a government that actually wants our communities to be prepared, then we have to set the example by being aware of preparedness and also on preparing and ensuring continuity for a more sustainable and resilient future. Thank you very much.
Thank you very much, Cristobal. That's excellent. And if there was one message perhaps that I could take away from your remarks, is that government is not immune to disruption that is caused by disaster, and that as a result of that, making the assumption of 100% operational capacity in the face of challenges and the consequences resulting from disasters could be a rather dangerous assumption to make. And that is actually quite a good lead in to the open discussion we'll have with our panel starting now. So if I could ask, please, for Joaquin Toro, for Doreen, Regis, Andrea, and Cristobal to please turn on your cameras and open your mics. There's a few discussion questions that I'll provide to you, and then we can move through our panel for some remarks on those discussions as we move through the rest of the session. Wonderful, thank you so much. So let's please get started. I want to build on Cristobal's point from his discussion around government continuity. And so my first question for the panel is this: what assumptions do you see within preparedness and response systems, in particular assumptions about the resilience of the various components of those preparedness and response systems, and as well about the interdependencies of those systems? So what are these key assumptions that you feel may be working against us if we continue down that path and we don't address those assumptions? If I could perhaps start with you, Regis. You've done quite a little bit of work with the WFP. Your organization has made significant changes in addressing some assumptions that you had made internally. I'm wondering what your thoughts are on this.
Yeah, I guess I want to highlight a couple of assumptions. I think one, there's an assumption that there are adequate systems and policies and frameworks, as well as human capacity to respond and an ability to manage the influx of support that we see in a high impact event. And I think really the challenge is in the practical application of these systems when these large scale events occur. And I think, the Caribbean has been a pioneer on many aspects of disaster risk management. But again, as I mentioned in my opening remarks, the changing dynamics of the region, I think, are showing where some of the challenges that moving forward that these systems need to be adapted to address. There's another assumption that I'd like to make that perhaps is a little bit provocative. A lot of people say, well, the Caribbean's resilient and people in the Caribbean are resilient. I don't know that that's always the case. I think in a way they have to be. You have to say that because you spend half of your year living on the knife's edge waiting to see if this is going to be your year. And that's not at all to underestimate the level of resilience that there is in the Caribbean, but I think it's almost this de facto response of it's the Caribbean, it's high income and upper middle income countries, and they'll be okay. And again, all those points on fiscal space and challenges that governments in the region have. And I think we see this in the levels of inequality in the region. And I know this isn't a call or a conference about COVID-19, but really COVID-19, like I mentioned, with natural shocks that occur, climatic shocks that occur, really have had such a profound effect on many of the Caribbean countries and have decimated economies, while countries have tried to mitigate the health impacts that we've seen elsewhere, and that we're unfortunately now seeing in the Caribbean. And so that reduced fiscal space, again, this issue of the lack of access to concessional financing, to grants, et cetera, for governments really undermined. So I think we've gotten to the state where, you know, things were improving quite significantly from a disaster management perspective, from an EPR perspective. And I think, like economic growth, the region sort of hit its plateau in a way of what you can reasonably expect, you know, a country or a region to do on its own. And again, you continue to see innovation, you continue to see really fantastic work happening, but it's this assumption that it's the Caribbean, it's resilient, it will bounce back. I would argue that that bounce back is not as high up as many people perceive it to be when these events occur.
Yeah, thank you, Regis. I think that's a very interesting point, and yeah, perhaps potentially provocative in terms of gaining a sense of, you know, what really is the level of resilience. There's everything is breakable. Everything has a breaking point, and having an understanding of where that exists, and not making critical assumptions about what that might look like, especially if we're talking regionally, given some of the significant differences between the countries within the Caribbean. So quite an important point. Andrea Grosvenor, can I ask you to comment perhaps on some of the assumptions that you've seen in your work with SEDIMA?
Thank you so much for that opportunity to contribute to this part of the dialogue as well in this way. I want to pick up from where Regis left off and to add 3 points of my own. And basically, the point that Regis has made is an absolutely fantastic point. It's a reality for us. And the whole matter of resilience, yes, we need to be resilient, but the fact is that these impacts are really eroding developmental gains. So you're not necessarily being able to build progressively. You're really and truly building only to be set back, to start off from, you know, from a worse place. So it's really eroding development gains, and that whole matter of the fiscal space and the impacts, for instance, like the COVID-19, really and truly have had really significant devastating impacts on the economies of the countries. And really and truly, we have to now look at new ways how we can be able to address the development agenda as we move forward, because really the preparedness and response conversation is really about how this really facilitates the continued development aspirations of our states. I want to say specifically on the preparedness and response portion of it, that some of the assumptions that we make and that we need to address is the whole matter of we assess on the equipment and the facilities, et cetera, but really and truly the whole matter of the people is an absolutely critical factor. If you are not building your resilience throughout the system that addresses the people and their own resilience, then you cannot have adequate preparedness and response, because you need to ensure that the people will be available to manage the systems, and that the appropriate leadership will be available at all levels. We have like this National Emergency Operations Center capacities, and then we have the within the communities or within the districts or the parishes or the departments. And if the leadership or the capacities there are weaker than the national system, then the system will break down. So we have to be able to build the system also from the ground up. The other point I want to make is that communications, we have these procedures and these processes that really relies a lot on one portion being able to talk to each other, whether it's national to community or private sector to private sector or private sector to government, et cetera. And in every single emergency, if we roll back the carpet to to the 90s and into the 2000s and whatever, every single emergency that we've had have really devastated communications. And communications has been a challenge in terms of being available all throughout the system for adequate coordination to facilitate the collaboration. And I think that's important because we need vertical communication, we need horizontal communication, and establishing those linkages. And finally, I want to say that I think that one of the assumptions that we made is that the events that we are seeing now will be like events of the past. That's not the case. The risk landscape is changing, you know, the whole matter of the cascading impacts, etc., and the cumulative impacts. This is now the reality. And really, if we are honest, our plans and our procedures, even though that they would have been developed with some level of imagination, really and truly probably do not have the level of imagination to really face what we are currently experiencing. Thank you.
Excellent. Thank you for that. Quite a few great insights, and I'm sure I can see Joaquin really capturing quite a little bits, which is fantastic. We are close for time, so perhaps a few comments from you, Doreen, and then quickly over to Cristobal before we'll turn to Joaquin Toro for a wrap up. So Doreen, a few comments on you on some critical assumptions, in particular, perhaps from you in terms of the assumptions around government continuity and the ability for government to actually operationalize many of these services during response.
Indeed, thank you so much. And I've been listening intently to the presenters. It is what we've discovered here is that a number of our departments and government agencies do not quite understand what our disaster response system is about. And so we have embarked on ensuring that those persons are in line with us, are understanding, and they know what it is that is necessary in order for continuity post a disaster. So the necessary preparation for a disaster event has to start with everyone understanding what their role is and how we can come together to ensuring that we are able to respond effectively to a disaster. And so we're working with our various partners, the various departments. And like I said in my presentation, it was necessary to bring all of the policy influencers who would be able to push our agenda. Had they not understood, or if they don't understand, then there is no way they will be able to work with us. And so it is very important that we have all on board with that same understanding, and that we are singing from the same hymnal in order to be able to have this not just on paper, but to test, to enable the testing of those continuity plans, and that every member of staff, every department understands what their role is in order to have that effective plan roll out.
Excellent, thank you. And I agree completely with you on this idea of unity of response and ensuring that our plans are not just paper tigers, that they're actually able to have significant impact when we do actually need them. Cristobal, a few quick comments from you. You know, I know you left off with this and you kind of launched us into this discussion. Before we turn it over to Joaquin, a few comments from you.
Yes, just briefly, and to be responsible of what I said. Just one brief reflection that it's also about supply chains, particularly on the Caribbean, that sometimes we assume that, again, the suppliers, they will be able to supply. And that's something that is another assumption that probably we also should be aware of how we, when we plan, we ask the suppliers at least, or actually work together with them to foster in them also resilience, continuity plans on them. So at the end, that ensures us a better response. So I think that's also a key issue, particularly in regions such as the Caribbean, in which supply chain it's critical. So that's something that also we have to be aware of when we're assuming that those things will come from our suppliers.
Excellent, and a great point around this before we turn it over to Joaquin in terms of that it's not just whole of government, that it really is a system of various actors from the government sector, from the private sector, from the multilateral and international institution sector that really enables response at multiple levels, especially given a changing environment and a changing vulnerability hazard and ultimately risk profile. Joaquin Toro, if I could ask you to make a few wrapping up and closing summary comments for us for this community session, please.
Thank you, Adam, and thank you, everybody. I have good news and bad news. No? First, the bad news. The bad news is that disasters are going to happen. We built risk in our lives, and we are getting the result of that every single year. And disasters are going to happen and will happen to the public and the private, to everybody who are in the islands. So it is important and super relevant that when we talk about emergency preparedness and response and government continuity, we think on an overall complex system that, as very well put by Andrea and also by Doreen, we have to do this in the overall objectives of development of the government. And every government should be thinking about how to reduce the existing risk, how to avoid the creation of new risk, and very importantly, and this is what it takes us here, how to respond to disasters more efficiently. And I think one paradigm that we need to start breaking is that the responding to the disasters is just the civil protection, is only the firefighters and ambulance. No, we have responsibilities. Let's take an example. Transport. Transport is a key element for the response after disasters. They are the ones who open the ways for the firefighters, for the ambulances. But imagine if there are no personnel, because as very well pointed by Andrea, it's about people, and people are in the government and also in their houses. And sometimes disasters happen when they are in their houses. So the person who has to press the emergency button in the transport minister is not there to press the button. Who's going to do it? No, I think it is very key that we start breaking these assumptions of the civil protection is going to respond, or the Minister of Interior. No, everybody is responsible, and we work as a network. And I think it is very important to link these two aspects, because governments, being national or local and even regional, have in terms of response, have two main things. No, one is the external response, how I'm going to provide the services to the population, and then the internal preparedness. As Cristobal mentioned, how who is going to press the button? Do we have the infrastructure ready to be deployed for the emergencies? And this is not just the firefighters, but for example, the debris management or the energy people that need to reconnect or provide the contingency lines for energy, and the systems, no, the systems. And I remember the last thing about leadership that Cristobal mentioned is that during Hurricane Maria, we were all watching what was happening, and it was a kind of a soap opera, very bizarre, when the Prime Minister was Facebooking that he was being affected by the hurricane. The roof of the house was gone, and suddenly we didn't have any news about that person, the man who is the leader of the country, who's going to make all the decisions for about a few hours, we didn't know what happened. That cannot happen. No, so in that sense, I think it is really, really important that we look at this more integral, and reducing the risk of critical services is an investment on development. Investing in hydromet, investing in systems is an investment. It's not cost. And I think even when there are no disasters, if we make sure that all these systems are properly working, we are going to benefit the population of the country. And just to finalize, I think that there's an important role that regional entities play in this context, especially in the Caribbean, where we have a network of islands pretty much, you know. And I want to highlight the efforts of CDIMA to make sure that, you know, they create these redundancies and promote this network effect to support the different islands. And I think we are in the Caribbean, as very well Regis mentioned, there are some specificities that are unique to the island, and some of them are very positive. And I want to highlight and see how we can support this, given that the crises are going to continue, the emergencies are going to be complex, but luckily we are becoming more resilient. And this group is making the Caribbean more resilient. And I hope we can get more of this kind of people working for that. And finally, we can say, Regis, that the Caribbean is going to be more resilient. And I think that is the aim, no? Thank you.
Absolutely. Thank you, Joaquin, so much. Thank you all so much for your time, for your panelists, for your insight and sharing your experiences with us today. For the participants in this session, thank you very much. I wish you all an excellent day, and please enjoy the rest of the DRM Focus Days 2021. Thank you all so much.